first off, can you explain for those who don't know the World Health Organization's global strategy towards eliminating cervical cancer?
Well, this is a really landmark strategy, actually, because it's the first time that they're bringing three prongs of the attack to cervical cancer together in one strategy and setting some really clear targets. So firstly, they really want to embrace the potential to eliminate this cancer. That means reducing the incidence of cervical cancer below that of the definition of a rare cancer. So the threshold to describe elimination after expert consultation has been set at 400,000 women annually, which is, is an amazing target when you think cervical cancer, even 100 years ago, was a major cancer in high income settings, and it is still a major cancer in low middle income countries. And so in addition to setting this threshold, WHO has done some modeling with some fantastic groups around the world to show the impact of the interventions. So the first intervention is to bring HPV vaccination in for girls aged 9 to 14, sorry. And the aim is to get to very high coverage, so 90% coverage. That provides a herd effect for protection for boys as well in countries where vaccination for boys is just too costly. The second prong of attack is screening. So whilst vaccination protects the younger girls and the generation coming through, what about women today who are already potentially exposed to HPV and where the vaccine won't be effective? Well, there we have screening. And that's been well established in high income settings. And I think many of us have been to cervical cancer screening in higher income settings. But the challenge in low income countries is that the extent of infrastructure, personnel that you require to really do an established PAP screening or similar it's just too the capacities just aren't there. So over the course of the last few years, WHO has been trying to introduce visual inspection with the CT acid as an alternative, particularly bringing in the treatment of any precancers found quite early on. So ideally on the same day. And what the new strategy is bringing in is also the HPV DNA test. This recognizes a much earlier event, brings in a lot of logistic possibilities that make that building of a service much better for low and middle income countries. Obviously, we have to get the cost of the test down, but it brings in exciting opportunities like linking it with self-sampling so that women have more choices and can do that intimate exam at home and also linking in with e-health navigational tools to really be as flexible as possible for women, which I think is a massive boon. And then, of course, the third piece is linking with the actual treatment. And when we look at services in some low and middle-income countries, well, even in some high-income countries, we often hear from women that have been to screening, but there's not been that follow-up. So early lesions have been neglected, or women have been lost to the system somehow and not got treatment, or their cancer has not been referred for diagnosis. So the idea of this third prong is to really link the screening target of 70% of women aged 30 to 49, at least 2 lifetime screens by age 35 and 45 with the HPV DNA test, and then 90% follow-up, both of screening positive cases, but also then of any patients presenting with cervical cancer signs and symptoms. And whilst that might seem an obvious thing in higher income settings, that is a major thing to really set up and organize in some of the lower income settings. But we do see a lot more of the infrastructure in place now. Many countries do have a cancer center, good surgeons, good radiotherapy, at least in one place. And so the idea is to help develop referral, strengthen the referral system, we don't lose the very women we can't afford to lose, which ones we already know have got a lesion or a cancer. So it's quite exciting to see all those components come together. It's great to see the ambition packaged as a real outcome-based goal, the elimination of this cancer. You know, for me, working as a cancer advocate for many, many years, the idea of actually eliminating a cancer and doing that globally is just very exciting. I'm going to cry. And what WHO has also done, because it is a long-term goal for many, many countries, is to set 10-year horizon. So by 2030, each of those targets should be achieved. So whilst elimination in a country like Australia is potentially already reached by 2028. 2028? Yeah. Yes, 2028 or around then. You know, some countries might take 100 years. So it's hard to keep any politician focused on a horizon like that. So what the 10-year horizon does is really try and break that down and get us up to those targets. Because it is also that coverage that is really going to start to bring the incidence down. Because what we see at the moment from the great modelling that's been done is many countries look like they're standing still. And of course, they're not standing still, they are doing some good work, but because of the rise in incidence of cervical cancer, it's like running on the spot. So those are the key elements that have really come together in this new strategy.
So in order to accomplish this goal, what will be required?
Well, first is political will. So what we see at the World Health Assembly is all member states have committed to this global ambition and these targets. And that's great. That's a great first step. And it was fantastic to see many of the high burden country member states really stepping up and championing this issue. But it's one thing to say this in Geneva, it's quite another to do this at home. And so there will be a lot of push from the advocacy side required. I think we need to bring all stakeholders together. So we do need the clinical community to sort of step out of the hospitals and think about what does this public health measure mean for them and how can they get involved. So there are a lot of challenges, but we also need to bring the community and particularly women into the conversation and also finding solutions. So that's why I really like the screening innovations that are really there, because it's working with women and how women want to be part of the solution and having a choice. And I don't know any woman that enjoys having a pelvic exam. If you have an alternative, that's fantastic. So I think we have to bring all those stakeholders together, but the first step is really to get the political commitment to take this forward nationally, to really urge governments to bring stakeholders together and develop a national strategy for elimination, showing that commitment and embedding it in guidance and policy work. But then it's just good old-fashioned graft, keeping going over the next decades to really grow the impact over time. And those are hard things to do, but I think we have some great expertise around the world and some fantastic supporting advocates to really push and make sure we keep the attention on this issue.
How would you say that the average everyday person could participate in advocating for this cause?
Well, I think the first step is to know and act yourself. So know about cervical cancer, know about vaccination, make sure people in your direct sphere of influence do understand the positives of vaccination, they understand it's safe, they understand it's effective, and especially as cancer survivors, the idea that you could have stopped a cancer with a vaccine, and so why would you not vaccinate the next generation? So really trying to address a lot of the vaccine confidence issues, because this is an anti-cancer vaccine. Letting people understand about signs and symptoms of cervical cancer, but also the fact that you can, through screening, find now with the test that's so much earlier, and that by going to screening, you're actually doing a prevention step as well as potentially an early detection step. But also not being afraid about coming forward when you think you have signs and symptoms, and knowing where to go. I think those are the first things. But if people could get behind the issue as well as an advocate and actually say, we want these services in our country. We want our country to be moving towards elimination goal, as much as Australia or Canada is doing. Why should our country sort of be okay with half measures? We want that. And I think one thing that politicians respond to is public pressure. So I think if we can get together behind advocacy groups, bring in the strong professional groups that can add kudos to the advocacy and work together to really make this this exciting potential and excitement for politicians. It's not about the money. It's an upfront investment. It will return over and over, because we will shift away from treating patients quite often at late stage where we're not going to get a lot of life years gained, to early treatment or even prevention, which is always better. So the investment case is there, the interventions are there, the tools are there. Why would a politician hold back? And that, it just needs us to push. So those, everything's there, and it's very exciting. And it's very exciting that the Director General of WHO has really taken this on as his own personal cause that he's pushing as well, which in the past hasn't been the case. So we really applaud that.
So what are some examples of organizations that people can get involved with to help this cause?
So I think nationally there's always a Cancer Society, and they can always link you up with groups that are more politically active and focused on cervical cancer, or those are the more community focused. As UICC is an international organization, and for this advocacy issue, we're well networked with different groups, professional groups, clinical groups, advocacy groups. And one of those networks is really rebranding itself to align with Elimination, called Cervical Cancer Action for Elimination. And we would love to hear from groups to individuals and groups to bring some more momentum in different jurisdictions. So anyone that's interested in getting involved, if they write to UICC, we can connect them with our members and bring them into this new movement, Cervical Cancer Action for Elimination.